Welcome to Top Athlete, a center for prevention, treatment, rehabilitation of sports injuries and musculoskeletal conditions. In this video, I'm not discussing any medical topic, but I want you to understand what Top Athlete program is all about. I'll talk about why I started this program, who our clients are, the services we offer to them and to the society at large, plus the future of Top Athlete program. Our vision as Top Athlete is to be the best physical therapy and sports rehab center in the world. Our mission is to offer our society the best and current physical therapy, sports and fitness services with qualified professionals in order to create a physically healthy everyday life for people. Our slogan is a healthy and physically active body. Increasing cases of players quitting sports or ending their careers due to injury is one of the reasons that led to the formation of Top Athlete program. Because I realized that most of these injuries are 1. Preventable and 2. Treatable. As I stated in the introduction, we focus on the prevention, treatment, rehabilitation of sports injuries and musculoskeletal conditions. But our services are not limited to sports injuries only. We treat patients with back pains, joint pains and stiffness. We do reduction of dislocations, management of fractures, that's application and removal of the casts and plasters. We have weight management programs and fitness in general like bodybuilding, CrossFit, aerobics, martial arts and more. We educate players, coaches, schools, colleges, national league teams and the entire society at large on the importance of sports. We also educate on the injury prevention and management to help our sportsmen and women be at their peak while training or competing. We manage injuries through 5 stages. 1. Assessment. When you present with an injury, the first thing is that we take history, do a proper physical examination, look at the signs and symptoms, and perform physical tests where necessary before determining the mode of treatment. If we feel that you are missing out something, then we proceed to the second stage, which is investigation. Here, I'm talking about radiographies like X-ray, MRIs, CT scans, or ultrasounds. This will help determine the severity of the injury in detail. Once that is determined, it's now clear to proceed to the next stage, which is management. From the investigations, if the injury is not severe and it won't require surgical fix, we proceed with physical therapy. For example, mild strains and sprains, you do not have to undergo surgery. For cases like undisplaced fractures, we just apply cast immobilization and the fracture heals. But severe cases like complete tears of tendons or ligaments, or cases like comminuted fractures, you will have to undergo a surgery. We have the best surgeons for the job. We will connect you to them, so you do not have to worry about the process. After the surgical intervention, we move to the next stage, which is very crucial, the rehabilitation stage. This stage is very crucial because it determines whether you'll go back to the sporting activity or not. At this point, as a patient, you need to practice patience and be guided step by step by a professional physical therapist who is well versed with the rehab process. That will help avoid development of complications that may hinder or delay recovery. Once the rehab process is successfully completed, we send you back to the surgeon for a review. If you are not a player or you are not participating in any form of physical activity, we clear you to resume your day-to-day duties. But if you are a player, we take you to the next stage called RPP. RPP is Resume Play Program. After sustaining an injury and staying out of play for a while undergoing treatment, definitely your fitness level drops. Your stamina, endurance, agility, they all go down. So in RPP, we initiate training that will help you get back to your fitness level. And the kind of training at this stage is specific to the kind of sports that you play. For example, volleyball players, they do a lot of jumping, landing, spiking, digging. Soccer players do a lot of running, kicking, passing, shielding. While rugby players, they do a lot of running, pushing, pulling, diving, and more. So the sport you play will determine the kind of training we give, so that by the time you go back to play, you will have an easy time merging with the rest of the team. Once RPP is successfully completed, we move to the last stage, which is education. Under education, we focus on prevention of injuries because that is the most important thing to do. Prevention is better than cure. This will help reduce the cases of recurrent injuries. When we educate players about measures that should be taken to prevent injuries, we reduce cases of injuries in sports in general. Because the person we teach will also go ahead and educate his or her teammates. I started this program 4 months ago, and we have successfully handled close to 200 cases. Someone could be asking, how do I manage to achieve this? I work hand in hand with a team of specialists. I have surgeons, fitness instructors, physical therapists, sports scientists, sonographers, and more. So, how does the future of top athletes look like? We strive to become the best athletic center in the world. We are determined and we are going to make it. Within the next 1 month, we'll be starting our weight loss and weight management camp program. Later this year, we'll also be launching Top Athlete TV, and everything is already underway. And also, Top Athlete has come up with a weekly schedule of meeting and educating different teams about sports and injuries in the long-term athlete development program. As usual, thanks for subscribing to my channel and viewing my videos. If you feel that our services could be of help to you as an individual or as a club, kindly call or WhatsApp the number on the screen. And also, don't forget to like, comment and share this video to all sportsmen and women in the world. Top Athlete, a healthy and physically active body.